Hi, my name is Brian Dierckman, and I'm an orthopedic surgeon with Elite Sports Medicine. I specialize in surgery of the hip, knee, and shoulder. I played football in college, and so that was my kind of driving force towards, again, wanting to be a sports medicine surgeon. And then during my kind of medical school and residency years, I started having a lot of hip problems and ended up having surgery myself, and unfortunately it didn't go well. And so I went on this whole journey to become a hip specialist, to kind of learn more about the hip joint and help save other people's hips so they don't have to experience what I experienced. My first fellowship is in sports medicine, which includes arthroscopy and joint preservation, which kind of lends yourself to younger folks. And then I also did a whole second fellowship in the hip joint. And so then I do hip replacements and tendon tears and all kinds of other problems that kind of creep up with time. And so I have a very wide range of patients that I take care of. The biggest thing that I was looking for was a group that really focused on patient care and the patient care experience, and making sure that there was an excellent experience, and that doing that would take care of everything else. And that was really what I thought was the most important thing about Elite, was they really focus on the patient care experience, and which allows you to be a good doctor and you don't feel pressured to treat people a certain way, and you can really just focus on doing whatever's best for the patient. I think my favorite thing about a surgeon is seeing people after surgery and knowing how much improvement you've made in their quality of life. You know, seeing, hugs and people crying and just out of pure gratitude and thankfulness that, that they were able to have a good experience and things went well, and that's phenomenal. There's nothing better than that. I think one thing that I really focus on and take great pride in is about the patient experience, is making sure that patients fully understand what's wrong, right? What their clear diagnosis is, and if we don't know, figuring it out, and then being very clear about what their options are. I use a lot of imaging. I show people, I have a tablet where I pull it out and I show people their imaging in the room. I use a lot of diagrams, I use a lot of models to really teach people. And I think people who are more knowledgeable and understanding about their diagnosis are more engaged and involved in their care. And it truly is a partnership between the surgeon and the patient. And I truly mean that, and that's a huge part of what I do. And I think it's what separates me from a lot of other people. One of the unique aspects about Elite Orthopedics is the opportunity to have physical therapists working directly with us in the office. I can't tell you how many times during the day where a physical therapist will come over and ask me a question about the patient in the middle of my clinic, and it's great because the patient's there and they can get immediate feedback and immediate answer, and it's a much more personalized care, and it's really, and that's what we focus on, is that personal touch about the patient experience, as opposed to maybe feeling like you're part of a factory or a machine, so to speak, which is very common for a lot of surgeons. Here we try to really be a holistic care, and physical therapy is a huge part of it. Thank you for taking the time to learn more about me and Elite Orthopedics. If you want to learn more, you can visit our website at eliteorthopedic.com or to schedule an appointment.